Well, thank you for joining us for today's all-of-nation effort to beat COVID-19, what is happening in Central Florida. First, I want to thank our partners for this important virtual conference, the Winter Park Chamber of Commerce. Without their hard work and support for today's event, this simply would never have been possible. So thank you, and a special thank you to Winter Park Chamber President and CEO, Becky Gardner-Eckbert, for all she has done, and also to her team for their hard work. You know, it's a real pleasure and privilege to have as our special guest today, Congresswoman Stephanie Murphy. Congresswoman Murphy is to be commended for all she has done on behalf of the people in her district in response to the COVID-19 crisis. And we thank her not only for taking time from her busy schedule to share her thoughts and insights with us today, but also for all her leadership during these incredibly challenging and difficult times. The people of the 7th District of Florida are indeed fortunate to have such an effective representative in Congress. And Congresswoman, we just want to thank you again for making time for today's event. So I'm Frank Cullen, and I work at the U.S. Chamber of Commerce Global Innovation Policy Center. At the U.S. Chamber, we recognize the critical role intellectual property plays in supporting our economy, creating jobs, driving innovation, and really doing so much to enhance and enrich the lives of all our residents. GIPC is happy to have a new program in place. This program really highlights the important work taking place across the country in response to COVID-19. We call that our Discover and Deliver campaign. And before talking a little bit more about that, I'd just like to point out that IP-intensive industries, which are really the innovative and creative industry sectors, drive so much of our nation's economy. And a lot of that happens right there in Florida, and certainly a lot in Central Florida. It's hard to believe, but 45 million jobs are created nationally by IP-intensive industries. Over 38% of our GDP is from those sectors, and we have well over half of our trade occurring from IP-intensive industries. In Florida alone, $8.9 billion are spent each year on R&D. And there's annual IP exports of over $50 billion. These are huge numbers, and they directly impact not only the local economy in Florida, but also, as I said, the very lives that everyone is trying to live to the fullest. So IP-intensive industries are tremendously important, and nowhere is that more true than our fight against the COVID-19 virus. Our Discover and Deliver campaign highlights the over 650 clinical trials taking place across all 50 states. They're happening everywhere in America, and they're happening in Central Florida. And of those 650 clinical trials, 170 are taking place in Florida, with 9 taking place right in the Congresswoman's district. And that includes over 44,000 participants. So this is tremendously important research that's being done to find either a vaccine or possibly new treatments to help people either sustain themselves through the COVID crisis or to get a cure. So, and also a preventive vaccine. So what we're looking at is really trying to talk today about that great work that's happening across America and happening in Congresswoman Murphy's own district. And it's now my pleasure to introduce Betsy Gardner-Eckbert, who serves as president and CEO of the Winter Park Chamber of Commerce. Betsy Gardner-Eckbert has been president and CEO of the Winter Park Chamber since 2017. And since taking the helm, she's focused on innovation and closing the relevancy gap to modernize this organization. They've been great partners, but I want to talk just a moment about some of the stuff that Betsy has done. Since March, she's taken the lead in Winter Park's efforts to respond to the COVID-19 pandemic. And those efforts include bringing more than 24 business leaders across numerous sectors together to form the Thrive Winter Park Steering Committee. It launched Feed the Frontline, which raised over $28,500 to buy food for local restaurants to deliver to healthcare workers and staff, helping 2 key community sectors survive during a difficult time. It also commissioned the COVID-19 economic analysis, which was underwritten by the Edith Bush Charitable Foundation and conducted by the Balmoral Group. And while the alarming economic results are in hand, Betsy formed the Winter Park Economy Recovery Task Force, again, pulling together leaders from various sectors to work on mitigation strategies, and they meet weekly to try to find a way through this pandemic. They've also worked in partnership with the City and Park Avenue District and led efforts to create more than 20 easy-to-access curbside to-go kiosks, making it easier for customers who aren't quite ready to enter restaurants and boutiques to easily access curbside delivery. You know, as a native of Winter Park, I think it's interesting that Betsy has just thrown so much attention to the chamber behind getting through this crisis and helping our local businesses thrive. And at the U.S. Chamber, we recognize the important role small businesses and local entrepreneurs play in keeping our economy strong. So her focus on such innovative culminated in the Winter Park Chamber winning the North American Chamber Innovation Awards grand prize. So congratulations, Betsy. We know you've had a great career working as an entrepreneur in London and also as director of business development for a UK-based mentor consulting firm. And we understand that you've done an awful lot on your own, developing your own companies. As a graduate of the University of Florida, I know how strongly you feel about your Florida ties. So with that, it's my pleasure to turn it over to Betsy. And Betsy, we look forward to a great event today, and thank you again for your partnership.
Frank, it's an absolute privilege. Our mission at the Winter Park Chamber of Commerce is to convene people and ideas for the benefit of our businesses and our community. And we're so grateful for the expression of that mission this afternoon. But I do want to pause and thank the U.S. Chamber, who have worked tirelessly in collaboration with our lawmakers in Washington to make sure that we have the relief that we now know and have measured has made the difference just in Winter Park. $200 million of GDP preserved by the PPP program that you all worked in collaboration with leaders like Congresswoman Murphy to make a difference right here in our economy, which we know has sustained at least an $800 million GDP loss. So the tireless work of the U.S. Chamber is very much appreciated here in Winter Park. And thank you for the opportunity for us to bring Congresswoman Murphy to our local community today. It's a privilege to introduce her. She proudly represents Florida's 7th Congressional District in the U.S. House of Representatives, which includes Seminole County and much of northern Orange County, including downtown Orlando, Maitland, Winter Park, and the University of Central Florida. She currently serves on the influential House Ways and Means Committee, where she is a member of the Subcommittee on Trade and the Subcommittee on Worker and Family Support. Previously, Congresswoman Murphy was a businesswoman and college instructor after serving as a national security specialist in the Office of the U.S. Secretary of Defense, where she received numerous awards for her distinguished service, including the Secretary of Defense Medal for exceptional civilian service. She worked on a wide range of security issues, from counterterrorism to foreign military relations to strategic planning for the department. Prior to her public service, she was a strategy consultant at Deloitte, and Congresswoman Murphy holds an MS in Foreign Service from Georgetown University and a BA in Economics from the College of William and Mary. She lives in Winter Park, Florida with her husband and 2 young children, and we are grateful to have you with us today, Congresswoman Stephanie Murphy. Welcome.
Good afternoon, and thank you, Betsy, for the kind introduction and for inviting me to be with you today. And it's great to see you, Frank. I really appreciate all the work that you do with the Chamber's Global Innovation Policy Center, and for being our host today for this as well. I really appreciate the invitation to provide some updates on the COVID federal response and to have a discussion on what additional resources the business community needs to recover. And what I usually do is start these conversations with some of the grim public health stats about COVID, but I think we're all too aware of the data. It's likely we know someone who's gotten ill and perhaps someone who's passed away, and I think we're all hurting, business owners included. But to put things simply, the health crisis has triggered an economic crisis that's really not going to get better until people feel safe to engage in their community, engage with businesses again, as they did prior to this public health crisis. And coming from a state and an area that depends heavily on tourism and on what I call, high touch, large crowd industries or experiences, we're acutely aware of how COVID-19 will impact the health of our community and the economy for the foreseeable future. I wanted to take a moment to share what my staff and I have been working on throughout the crisis, both locally and in Washington. To begin, the past 6 months have highlighted just how important job security is, and in turn, just how much businesses are struggling to keep workers on their payrolls and to stay in business. In addition to thousands of who have phoned into my office, my team has personally assisted over 550 people who have reached out in desperation, really, for guidance on how to overcome the major hurdles of accessing unemployment insurance and economic impact payments. I've also hosted town halls and listening sessions and webinars just to try to keep the public as informed as possible. The first of those events was in mid-February alongside of public health experts as well as our county emergency management folks before there was a single case of COVID in Florida. Because having worked on pandemics at the Department of Defense, I understood that it was important to be ready to respond. We also had another event to offer a direct line to the SBA during the original tense days and weeks following the creation of the PPP and the EIDL programs for small businesses, where, you know, there was sort of rolling guidance that was coming out and a lot of confusion, and providing access to SBA directly was something I thought our businesses could benefit from. I've also spoken to frontline health professionals who didn't have access to the PPE that they felt would keep them safe, and yet were still required to do their jobs. And most recently, we had conversations with teachers and school administrators who were understandably concerned for their health and their ability to do their jobs. Everyday Americans, private sector businesses, and elected officials have to be lockstep in order to share accurate public health information that'll save lives and ultimately help quell the spread of the virus that will enable our economy to fully recover. And I think one example of this partnership was showcased in the development of a COVID-19 vaccine. Over $2 billion in grants has been allocated for the development and manufacturing of vaccines and treatments. Those dollars are being put to work right here in Central Florida, where 9 clinical trials are taking place. Most of the trials are for COVID-19 treatments, and 2 are for vaccines, and 1 is an observational clinical trial. And this funding was made possible by 4 major bipartisan bills Congress has passed to date, including the CARES Act and a 4th interim package. I have to say that, you know, the size of and the speed with which these bills moved through the legislative process was historic. It was really, there was a lot of bipartisanship and a joint effort in hopes to pass these bills to surmount an unprecedented crisis. But I have to stress that while a lot of important work has been done, our work is still far from over. And as the pandemic continues with no clear end in sight, I think the need and the urgency for a 5th relief bill has only really grown. In May, well over 100 days ago, the House passed the HEROES Act. It was a $3 trillion comprehensive relief package that included an extension of the federal unemployment benefits, rental assistance and mortgage relief, and additional funding for testing, tracing, and treatment. And unfortunately, I'm sad to say the Senate didn't do anything for 2 months, even though COVID was continuing to spread across communities in Florida and in other states. But in late July, the Senate finally released their proposal called the HEALS Act. They did it so late that we couldn't prevent the weekly unemployment benefit from expiring or the prohibitions on evictions from expiring. And I think in many ways that was legislative malpractice, pure and simple, to wait so late that we couldn't prevent what we saw coming from happening. And negotiations have stalled ever since. I've been incredibly frustrated by the lack of urgency to reach a compromise by leaders on both sides of the aisle and in both chambers. And, now isn't really the time for inaction. we have to restart bipartisan, bicameral negotiations on a fifth relief package that is commensurate with the scale of this public health and economic crisis. As co-chair of the Blue Dog Coalition, a group of 27 pragmatic Democrats, I recently led a letter to House and Senate leaders saying exactly this, that they needed to get back to the table. And in that letter, we noted that while there were differences between the House HEROES Act and the Senate HEALS Act, there was a lot of common ground that we can build on. And in our letter, we laid out what the contours of a deal should look like. So for example, we think a deal should include an extension of the federal unemployment benefit, somewhere between $400 and $600 a week. I think 400 was what the administration put forward. 600 was what was passed in the early weeks and months of this crisis. It should include another round of stimulus checks. I think those checks help to keep our economy from, well, it was a lifeline to the families that needed it, but it also helped with our economy. I think it should include some measures to keep workers tethered to their jobs and their employer-based health insurance and off of unemployment. And this would include a major expansion of my employee retention tax credit. I've worked very hard to get bipartisan support for this, this tax credit, and I'm proud to say that it is in both the House and the Senate bills. I would say it's one of the few things that exist in both bills. Additionally, I think it should include another bipartisan bill that I've worked on. It's the Clean Start Back to Work Act. And that would provide a tax credit to businesses for hiring cleaners and buying cleaning supplies so that they can provide a safe environment for workers and customers. Every workplace, every workplace and business has seen a significant increase in the expenses that they are having to apply towards cleaning supplies, and I think they should receive a tax credit for that. Additionally, I think another area of common ground is some financial support for state and local governments and K-12 schools and institutions of higher education without unreasonable conditions. I know there's some debate around the state and local piece, but I think everybody agrees that the schools could use more resources, and in some ways that, since education money is administered by state and local governments, that would help out quite a bit. And I think absent fair federal funding, the reality is that state and local governments are going to have no choice but to make painful budget cuts to key services like police and fire department, or to raise taxes for already struggling families and businesses. And I know that that's not something that is sustainable in this moment of crisis. And I'll just say, I don't think that this is a moment for us to retreat to our partisan corners, and we can't let the perfect become the enemy of the good. We have a divided government, a Democratic held House, a Republican Senate, Republican in the White House. So I think in order to get things into law, principled compromise is essential. People are hurting, our economy is still suffering, and we need to act, and we need to act now. I'll close by stating an obvious fact. We're all in this together, but I have to say that I also recognize that we're not all in it in the same way. And rest assured that I'll keep urging congressional leadership to work quickly across party lines to address this pandemic, and fighting to help industries hit especially hard that need that help. I think lives are on the line, and delaying or denying help to Americans is irresponsible. So I'll continue to be pushing. And with that, thank you again for having me, and I look forward to our discussion.
Well, thank you, Congresswoman. Obviously, your district is very fortunate to have such a thoughtful and hardworking member of Congress. And I'd be remiss if I did not express on behalf of the U.S. Chamber of Commerce our appreciation not only for what you do in terms of working in Washington, but also the livelihoods of your constituents. The work you've done on providing economic relief, this work that Congress took very quickly, as you pointed out, has really been instrumental in helping people through this crisis. And more work, as you said, needs to be done. So we applaud your efforts. We applaud your willingness to work in a bipartisan manner. But most importantly, we applaud the fact that you're there to actually find solutions and actually work on behalf of your district. And we need more people like you in Washington. So thank you for that. And again, we'll look forward to following up on a few of your comments. We've created this interactive map as part of our Discover and Deliver campaign, which breaks down where these clinical trials are happening. As I pointed out earlier, and you also pointed out, with so much happening in Central Florida, you have over 44,000 residents in your area participating in these 9 trials, and they're both for treatments and also for vaccines. What do you think makes it so important to have something like that taking place in your backyard in Central Florida? And it's obviously more than just getting to a treatment or vaccine. There's economic benefits. What are some of your thoughts in terms of why that's important to have in your district?
Well, first, let me just congratulate you on the Chamber's interactive map. It is enormously useful, and it helps us to understand the diversity of the clinical trials happening in the state, as well as on a district by district basis. And I always talk about how a lot of our legislating has to start from a data and focused place. And so I nerd out a little bit. I think it's a great map. And I think it's always exciting to be part of cutting edge research and development, but especially so now when the stakes are so high. And if Florida's 7th Congressional District and the folks in this area can do its part to make sure that good therapeutics and vaccines are developed and reach not just the rest of the United States, but maybe even the entire world, I think that will be an incredibly important contribution and a real honor to be a part of that. When we look across the United States at how different states have been impacted by COVID-19 in terms of total number of cases, Florida is ranked 3rd nationally. Our spike came a little later than other locations, which means we still have a lot of COVID in our community today. And because of this, we have a lot of potential candidates for the clinical trials as well. And we have some very sick patients, and getting them access to treatments like I'm terrible at medical names, but remdesivir. Yeah, remdesivir and convalescent plasma therapies, which have been granted EUAs and are being studied for their efficacy against the virus, could, if they prove effective, be a matter of life and death for the infected individual. So it's possible that some of the treatment trials, by reducing infected individuals' viral loads, will help to reduce the spread of the virus from person to person. That would also help our community. And running the trials in this district is also really good for our healthcare workforce. Remdesivir appears to help patients recover faster, so 11 days instead of 15. And if patients can be discharged from area hospitals sooner, this helps to reduce the strain on our healthcare system and on our essential healthcare workers. And then in terms of the vaccine trials, again, testing in areas of the country like Florida, where there's still a lot of community spread, means that it should be possible for us to get answers faster about whether a vaccine candidate is safe and effective, because more people are likely to be exposed to the virus than in communities where there's not a lot of community spread and they've gotten a hold of it. I would also note one other thing that makes it exciting for us to be involved in this is, I think what was underscored with this pandemic is that Florida has more work to do to diversify our economy, and here in Central Florida particularly, and the innovation that comes with being a part of these types of clinical trials and being engaged in an industry that is not high touch or not the tourism and such. It allows us an opportunity to take a peek into and maybe build out some of those other industries to diversify our economy here in Central Florida. So I think there are a lot of benefits for us being involved in this trial.
Thank you for that. And you touched on something that I think most people realize, that there is a lot of innovation happening in Florida and a lot of creative industries in Florida. And it is a very big driver of the state's economy and your local economy. But what we're seeing during this COVID crisis is really quite remarkable. It's an unprecedented level of cooperation between innovative companies, many in the biopharma sector. There are public-private partnerships that are going on, again, at unprecedented levels. And we're seeing an opportunity for folks to work together collaboratively in ways that we've never really seen in recent years. Can you touch a little bit about the important role that both sectors, the public and the private sectors, play in terms of these kind of collaborations? It's interesting, you know, for every dollar that the government spends or research institutions spend, industry might spend 10 to 100 times that to actually bring a product to market. But they all play an essential role. Without that foundational research, more innovation and development cannot occur. But could you talk just a little bit about how you see that playing out?
Sure, we absolutely have to harness the strengths of both the public and the private sectors. That'll help us maximize our chance of developing successful diagnostics, therapeutics, and vaccines. And after all, those things will be our path path to overcoming the health and economic crisis that we're all in the midst of. And although the U.S. has been very hard hit by this virus, and harder hit than, you know, arguably we had to be. Our country is also home to many of the world's most agile companies and cutting edge research engines, brilliant scientists and best research universities. We have a second largest university in our district that is a research university. We've got top-notch doctors in both private hospitals and clinical practice, as well as in our government research institutes. And all of that, in addition to all of that, we also have some of the largest philanthropic organizations. And that is an incredible combination of entities and people and minds and passionate hearts towards achieving significant innovations. These are real significant advantages for the U.S. to be able to leverage now. And as you've said, we've seen unprecedented levels of public-private cooperation. And our government should continue to provide the leadership, resources, and coordination to make sure that each of these high-performing sectors works together to help us reach a vaccine as safely and as quickly as possible. I think there are several areas where government can assist and is assisting the private sector right now. In terms of resources, the US government can help companies take risks that they wouldn't normally take. The US government has already entered into contracts with companies to manufacture millions of doses of investigational vaccine before the vaccine's effectiveness is proven and the company has gotten approval or an EUA from the FDA. You know, people call this parallel rather than sequential development of a vaccine. And parallel development helps you compress the timeline, but it's not something that is normally done in the private sector in the development of a vaccine because you don't want to waste the resources there. They tend to do sequential development. And so in this case, this parallel development of a vaccine wouldn't be possible without government backing. And if these government-backed vaccine candidates are successful, they'll be ready for distribution much faster than market forces alone would have allowed. And I think that's a goal we're all hoping to head towards. And then the other thing is that the US government is also leveraging its clinical trial networks to help companies get enough participants for its trials and preparing DoD assets to help distribute the vaccine. So we want to make sure that as soon as we do get a safe, tested, approved vaccine, we don't run into supply chain issues. So there's some advanced work being done there. And, you know, there will not initially probably be enough vaccines for every American or for a global population. So the government will also have a key role in helping to prioritize who gets the vaccines first, and then how we make sure that not only is American need met, but if there continues to be global need, that's met as well. Because what we've discovered here is that if COVID continues to spread around the world, our country is not immune to that, so to speak. Will remain vulnerable if it's continuing to spread. So I think our government has a real role in helping to stop the spread of the virus, and doing so working in conjunction with the private sector.
Well, thank you for those insights. You know, at the U.S. Chamber of Commerce, we've done a lot of research on the link between a strong IP system and an IP system that really supports innovative and creative industries, but it also helps protect consumers, your constituents, from the threat of counterfeits and other types of threats. So I'm interested to hear your thoughts on that link between intellectual property and innovation and creativity. And do you feel that the type of policies we have in the United States have helped us as we continue to work through some of these challenges, particularly as it relates to the current crisis?
Well, so fun fact, I think I'm one of 7 members, one of a handful of members who is a patent holder. So I'm not only familiar with the connection between intellectual property protections offered by our legal system as it relates to innovative products, but also have personally gone through the process of securing that intellectual property protection. And so very familiar with it. I think that legal system that that creates IP protection is one of the reasons that the U.S. has such innovative companies, and why so many health and medical innovations happen or developed here, happen here in the United States. With IP protections in place, companies are incentivized to keep doing research and development, knowing that they will have protections on their hard work and their investments. As you know, I sit on the Ways and Means Committee as well, and one of the issues I've focused on is making sure that our global trading system is based on enforceable rules, rather than being an unfair playing field for U.S. companies. U.S. companies shouldn't have to compete with foreign-based companies that mistreat their workers, pollute the environment, steal intellectual property, or receive excessive government support. And so making sure that we have an enforceable trading system with rules of the road, with IP as one of the key areas where we need our legal values, legal system shared with the world to create the rules of the road to ensure that people aren't benefiting and stealing from American innovation. It's an incredibly important area in the trade world as well.
Well, we appreciate your hard work on trade issues. As I pointed out earlier, a lot of the trade from Florida is from IP-intensive industries, and also just your understanding of that correlation between a strong IP system and innovative and creative industries. I know you have a busy afternoon. Just before we close out, I want to say we could talk for hours. I mean, we haven't touched on things like the way technology is allowing us to work remotely, allowing our kids to learn, allowing us to be entertained, and also allowing us really to connect in ways that we didn't before the pandemic. So technologies go well beyond just finding a vaccine or more treatments. So we appreciate everything that's happening in Central Florida. Before I wrap up, I'll just give you one final chance for the final word. And just again, thank you so much for your time and your thoughtful leadership.
Well, thank you so much for having me. And this was a great conversation. Clearly, there are so many exciting things happening in Central Florida, despite the public health crisis and economic crisis that we're in. But it's because one of the things that I've always said about why I'm so proud to represent this area is that we have this really unique blend of the kind of creative minds that can build world-class entertainment like you see down at the parks and port people into different worlds and stimulate their imagination, combined with the kind of technical know-how that comes from the kinds of people who innovate and create the platforms that send people to space, layered on top of a world-class education system that boasts one of the largest research universities, as well as a really robust set of other types of schools and technical schools. And then a community that cares an awful lot about each other and wants to stay engaged. And so we're seeing the strengths of all the things that make Central Florida great play out here in our effort to get through both the public health and economic crisis, and just look forward to continuing to work with you and with Betsy at the local level to try to support local businesses here and local workers, because I think it's incredibly important. So thank you for all that you're doing.
Well, we appreciate all you do. The Chamber's proud to support you. We know that your kind of leadership is what the country needs right now. So thanks for taking time to be with us today. And I know how well served the people of your district are. Thank you, Congresswoman.
Thank you, and have a great day. Stay safe, be well.
And now it's my real pleasure to turn to my colleague, our Senior Vice President at the Global Innovation Policy Center, who leads our policy work, but also has a great understanding of many of the issues, such as the trade issue that Congresswoman Murphy raised. Patrick Kilbride, the floor is yours.
Thank you, Frank. Great job, and thank you to Congresswoman Murphy. What terrific leadership the Central Florida region in the United States have in Congresswoman Murphy. We're here with two other terrific leaders today that we're going to ask a few questions and get a little bit of a local angle on this story about the race to vaccines and therapies to address COVID-19. And so I'm very pleased to introduce from the Central Florida Regional Hospital, its Chief Medical Officer, Dr. Sean Benoit. Welcome, Dr. Benoit. And from Florida Bio, the industry association representing Florida's biotech industry, we have Nancy Bryan, the president and CEO. And Dr. Benoit, you know, we set out to really localize this story of innovation to fight COVID-19 in conversation with local leaders like yourself and Nancy and the Winter Park Chamber of Commerce. As it turns out, you're a local leader in Central Florida today, but having studied and practiced in the Washington, D.C. area, you're local to us too. So hi from your old stomping grounds. And Nancy, you know, your resume is so impressive. Having served in some major pharmaceutical innovators as well as some biotech startups, you really have, I think, a very valuable insight into how this process works, into the collaborations that are necessary between public and private sectors, between nonprofits and hospitals and innovators. And so very excited to have this conversation with you. Dr. Benoit, maybe we could begin with you. You really find yourselves on the front lines here at Central Florida. Can you tell us how that response played out at your hospital?
Yes, thank you very much for asking that question. We seem to be having some technical difficulty with our video, but hopefully you can hear me.
Absolutely.
Thank you. As you know, I think all of us had to be very limber and very flexible when this pandemic first hit. We went through several different iterations and steps. We're fortunate to be part of a larger group in HCA, but nevertheless here locally, we communicated multiple times with even our local hospitals who we typically would not be talking to, and those executive teams, just to really take care of the community. And we spoke about many different things, as you know, about different medications that were starting, the masking, the washing hands, how bad is this, what is the transmission? And we learned many things over this past few months that we did not know in the beginning. And I think that's one good thing that's come out of this, is that we're much stronger in our knowledge of where things are, even though this still is a novel coronavirus and it still represents many things that we don't know about this particular virus, but we did prepare quite a bit. I think I'm back on, whoops, never mind. And, but we prepared really in a way, and we really try to help our staff understand transmission, PPE, help the medical staff understand what different medications we should be using at the time based on what research and knowledge was available at the time. And so here we are several months later, and we're still doing this battle, but it certainly has been quite a transition, as you mentioned.
So, you know, you talked a little bit about some of the early challenges with you know, shortages of PPE. Ventilators were a big issue at the onset of the pandemic. We've had at times shortages of diagnostic tests. What about now? Like, are there particular challenges that you're facing now that you're learning to address, as you put it?
Yeah, I think a lot of our challenges honestly have to do with, it's not even medical anymore. A lot of it certainly is complacency, making sure that the public understands that even though we've seen a decrease in numbers, the transmission rate and the infectivity rate is still high. And then a lot of it is making sure that the morale of our team is also kept up. We've had a lot of frontline workers who volunteered to take care of these COVID-19 patients early on. And so we do many things and multiple things to make sure that we boost them up, not just within the hospital, but our pre-hospital providers as well. There's also our rehab facilities, just to help people understand that we appreciate the work that they're doing. We keep an eye on our PPEs every day, our masks, our gowns, our gloves, our N95. So certainly we keep track of all those things. We keep track of which medications come into the state of Florida. But a lot of it's still challenges, to your question, has to be with making sure that our staff feels extremely supported during this time.
Right, and Dr. Benoit, you talked about how we all need to come together and help each other out here. And in fact, what we're seeing is, which is really the premise of this Discover and Deliver series, is that people are stepping up across the country. We have more than 700 by last count clinical trials going on, addressing various aspects of COVID-19, including, as Frank mentioned, at least 9 in Congresswoman Murphy's district. And Nancy, your members have a critical role to play, both sort of those large innovative pharmaceuticals, as well as the small biotechs that are driving so much of the innovation. Can you speak a little bit to the role of those companies?
Sure. So I think you make a great point that the innovation is not only with the large biotech, but it really spans the mid-size, the small size, the universities. Everybody's, I think, playing their role in contributing to the advancement of treatments and vaccines to mitigate the virus. I think what we've seen is, from a regional perspective, I can help illustrate that by highlighting a couple initiatives. First with UCF, what you'll see is there's groups of UCF scientists that are developing groundbreaking technologies that I'm not sure a lot of people have heard of to date, like the development of protective film to catch and kill COVID-19 virus, and that's used to protect masks, gloves, PPEs. There's the development of a novel laser beam and the development of technology to make saliva heavier and stickier to reduce COVID-19 transmission. And getting to the public-private partnership, all these are done with the support of DOD and NSF funding. So, congratulations to UCF for some of their innovative work. We also, in the region, I want to acknowledge the hospital system's participation in clinical trials. And I know that there's been some discussion of that earlier, but looking at Advent Health as an example, I mean, they right now are involved in 1 registry trial, 2 expanded access trials, 3 critical care trials, and involving more than 500 COVID-19 patients. The trials include convalescent plasma, remdesivir, Lenzibumab, and Regeneron's new multiple monoclonal antibody product. So that just gives you an understanding of what's happening just in the area. In addition to this, you'll see that Advent Health is going to be joining Operation Warp Speed and in testing another vaccine. So they anticipate maybe up to 5,000 patients. So we also have some other companies that are creative. A local company, Hesperos, that does pioneers organ on a chip technology, has developed that technology to test the response, the immune response for products against COVID-19. So there's lots of different things going on. I think if you look in total across Florida, the response to fight COVID-19 was really strong and swift. It involved a significant number of our members, our companies, universities, research institutes, and health system. And it covered all facets: medical devices and supplies, testing, vaccines, therapeutics, manufacturing, epidemiology, and patient care. There's facets of all of that going on in the state. So I think, did I answer your question?
Absolutely. I mean, that's terrific. It's really exciting to hear, because I think, sometimes those of us who are not in it, as you and Dr. Benoit are, you tend to think that, okay, this fight against COVID-19 is happening somewhere else. It's happening in a research lab somewhere, but in fact, it's happening in Central Florida. Your companies, your patients, Dr. Benoit, certainly your doctors and nurses are all and leading the fight, really. Dr. Benoit, Nancy mentioned, several sort of potential therapies that are being tried out against COVID-19. As a sort of frontline warrior here, how do you choose, both for an individual patient and, sort of on an institutional basis, how do you choose which approaches you're going to test at any given time?
Thanks for that question. I think oftentimes it's so much based on what current information we have at this time. I think many people, for example, have heard of remdesivir. They've heard of it now. The Congresswoman spoke about it earlier and how it decreases the length of stay. But early on, we were talking about lopinavir and ritonavir, other antiviral agents that were possible, that maybe we can combine those and use those. And we had a whole host of different medications, and many people were throwing a lot of different things, including the kitchen sink, at coronavirus. What can we do in order to treat it? And then convalescent plasma, which we have used years ago in other disease states, we felt we should try this. And convalescent plasma has been one of those things that we have used in combination with remdesivir. Now we have our steroids, the dexamethasone and decadron, that we're using as well. And so a lot of it, to answer your question, is based on what type of information do we have at the time. We have so many people coming in. We talk to our colleagues. We look at our research and we say, listen, this is still novel, but we have to give it a shot. And I will tell you, yes, for example, convalescent plasma, the results are still out, whether you look at NIH or FDA in terms of does it truly make a big difference. But we certainly have seen it has made a difference in some of our earlier patients if we treat them earlier versus some of the others. So we're awaiting the results of a double-blind study related to that as well, certainly a particular study. But for us, we're happy to see these different trials. We're happy to encourage people to get involved in the vaccine trials. We think that's an amazing thing that's going to happen when it does occur. And so we keep an eye on what's happening with research. We talk to our colleagues. I will tell you, typically, however, early on, every physician was sending me every therapy possible that they wanted us to try. And of course, we couldn't do that as well. So we didn't have a shortage of suggestions, that's for sure.
A good problem to have, I guess, although, the challenge is even with medicines that we know already work for one indication in certain types of patients, we don't know that it'll work for everyone. I wonder if I could ask you, Dr. Benoit, as you look at some of these different approaches, how do we ensure that we're able to test whether a certain therapy works across, people from all different backgrounds, a really diverse patient population in these trials?
I think the trials are trying to reach out. So when the people sign up, whether it's for trials or whether it's for the vaccine or whether it's for a novel therapeutic agent, we are encouraging a lot of these research institutions to be very selective. In other words, to be very broad-based and very diverse, because so many different segments of our population have been hit very hard by this virus. And so we want to make sure all these therapeutic agents hit people because there's so much we don't know. We understand that there is a socioeconomic difference in many different populations, but there may also be a lot of racial disparities and a lot of other things that we're not exactly accounting for. So we want to get as wide a net as possible and get many of those individuals into these tests so that we can feel very secure that our treatment is something we can recommend to everyone. And eventually when this vaccine does get developed, it's going to have to be more widespread than other vaccines we've seen in the past. We currently recommend the flu shot, not for everyone, but certainly for most vulnerable population. But for coronavirus, it'll be for everyone. So it'll be totally different.
I have to say it's really encouraging to see attention to these issues in a way that we haven't before. I think the pandemic has really forced us to confront some longstanding challenges, and you do see the communities, especially the medical community, the innovative biopharmaceutical community responding. Nancy, I wanted to ask you, we've already talked a bit about some of the collaborations that need to take place, but it's easy to say they have to take place, but maybe you could, having been a part of this in a lot of different angles, maybe you could describe what it looks like. What's the role of governments and hospitals and startups and the majors as well?
Well, particularly when everybody has a role. I mean, particularly, in the fight against COVID-19. I think everybody makes a big difference. I mean, the government is certainly key in helping the private sector do what they need to do. In terms of funding, in terms of regulatory hurdles, in terms of support along those lines. And I think we're seeing a lot of that. The industry itself, I think what's been so impressive is the collaboration across the industry. I mean, what you're seeing is, folks in the medical device fields, jointly developing ventilators when ventilators were an issue. We forget about that, but I believe Medtronic, published their IP so other people could actually start to manufacture, and we can meet the needs in the worldwide marketplace. So and now we're seeing the collaboration of all the pharmaceutical companies, and they're collaborating at more than ever before right now, trying to really figure out what's going to work and what's not going to work. Scripps is in Florida, and probably the recognized expert in terms of our messenger RNA, which is the technology we're talking about when we talk about COVID-19. And they're always on the line with everyone trying to figure out whose technology might work, and if there's tweaks that need to happen, and how they can accelerate the clinical trials and get the data out. So it's unparalleled cooperation among the industry.
It's been impressive, and I think an aspect that might be lost is we're a strong pipeline in the United States because companies like the ones you represent make investments over many years. So remdesivir, for instance, having been tested as an antiviral therapy for over a decade, some of these other possible therapies, dexamethasone, for instance, and now available as a generic. But we've got the infrastructure to really test, do it rigorously, make sure they're safe and effective. And I will say that I'm just extremely grateful that leaders, Dr. Benoit in Central Florida, and many others that we've spoken with over the last few weeks and months across the United States, are so ready and so capable to take on these challenges. Let me just we've got just a couple minutes left. Let me turn to you, Dr. Benoit, and then to Nancy for any final thoughts that you'd like to share with our audience.
Patrick, thank you very much for giving us this time to speak. We're very proud of our workers, the hard work that they're doing on the front line. We're proud of the patients too, as well. They come in here and they absolutely want to get better. With the population that we see within the institution is a little bit older, as you've seen in the national data, and we're proud of them when they leave us and they're able to walk out of here on their own power. As you know the numbers as well as I do. That's not everyone. So I think sometimes the people who survive, we may forget about them. They still struggle afterwards. So we want them to know that we are still in their corner and looking for their success as well. And we also want to thank the community. We have not done this alone. The counties have worked very closely with all of the hospital systems to make sure that we had adequate PPE. They checked in with us. They worked with us on a daily basis, especially at the height of the pandemic when we had no idea what was coming. And so we really want to thank our community partners because we would not have been able to really do it without them and the efforts that they have shown in making sure that the county stays safe. So thank you very much for this time talking to you today.
Thank you. Very well said. And Nancy, over to you for the last word.
Great. I would just like to thank Winter Park Chamber of Commerce, the U.S. Chamber Global Innovation Policy Center, Representative Stephanie Murphy, and Dr. Sean Benoit. I mean, it shows the collaborations that's necessary, I think, to fight against this pandemic. On behalf of BioFlorida, I just want to say that we greatly appreciate the opportunity to participate in the event. It's important to us to be able to highlight the life science industry and its contribution in the fight against COVID-19, not only in terms of research, but also in terms of supporting the patients and those that are on the front lines battling the disease every day. A little bit of a plug, if you don't mind. BioFlorida's annual conference is coming up. And I just wanted to remind folks that it will be virtual and it will be scheduled on Thursday, October 29th. And just want to encourage everyone, if they can, to attend. It's a great opportunity to really learn about the progress of the treatments for COVID-19 and other diseases. We'll have the experts and thought leaders across the country there, accessible to your questions. And it's an opportunity to be able to connect with the executives in the industry. And one of our key goals is to strategize on how to lead Florida's life science forward. So we need everybody's input, everybody in the sectors that we already discussed. So I really thank you for this opportunity. I think it was a great, really a great meeting.
Thank you both. Terrific leadership in the Central Florida community, and we appreciate you. Betsy and Frank, over to you. Thanks so much.
Thanks, Patrick, and thanks for leading a fascinating discussion. I know we're quite short on time. I want to thank all the folks who took time from their busy schedules to join us today. Once again, thank my colleagues at the Winter Park Chamber of Commerce. Betsy, you guys do a fabulous job. And obviously the Congresswoman and her staff for taking time to be with us today. The only way we're going to get through this is with innovation and working together. I think we saw a great example today of some of the ways that our industries are working to get us through this. And I hope you all stay safe. And we look forward to getting to the other side of this. Betsy?
Thank you, Frank. And thank you to all of our panelists and presenters. We're grateful to be able to bring our community together virtually this afternoon. For more information about what we do here at the Winter Park Chamber, please follow us on Facebook, Instagram, LinkedIn, and Twitter, or subscribe to our newsletter by logging on to winterpark.org. We're grateful again to the United States Chamber of Commerce and Representative Stephanie Murphy and our panelists today. Thank you for all that you're doing in the fight against COVID-19. We look forward to seeing you at some of our future programming soon. Many thanks again.